Hello, everyone, and welcome to this online recording. Today, we are very honored to be joined by Congresswoman Underwood for this fireside chat. She has been the strong voice on issues that matter deeply to our communities, and we are very grateful for the opportunity to hear her perspective, learn from her experience, and discuss the challenges and opportunities ahead. And thank you for joining us, Congresswoman Underwood. Without further ado, let's start our first questions. You and along with Congresswoman Adams launched the Black Maternal Health Caucus in 2019. And can you explain or share with us why it was important to build that coalitions at that time and why it remains a critical group even 7 years later?
Sure. So we launched the Black Maternal Health Caucus in April of 2019 in response to America's maternal health crisis that is getting worse, not better. We know that the United States leads the industrialized world in preventable maternal deaths, and that Black moms are 3 to 4 times more likely to die than their white counterparts. And we'd seen some data that suggests that a huge number of those deaths were preventable. We now know it's over 80% of the deaths are preventable. And we knew that there was an opportunity to bring that conversation to Capitol Hill. And so our mission was really simple: to elevate the maternal health crisis and work to advance policy solutions. Now, I got to tell you, Sally, we were really surprised that there was this huge, overwhelming bipartisan interest in tackling this topic. So the Black Maternal Health Caucus has grown to be one of the largest bipartisan caucuses on Capitol Hill. And we have worked to develop and advance our signature legislation, a comprehensive bill called the Momnibus.
Yeah, and a following up question would be, what are the biggest issues that the Black Maternal Health Caucus is currently focused on?
The Black Maternal Health Caucus has been successful in unlocking hundreds of millions of dollars in funding for Momnibus priorities. So even though the full Momnibus hasn't passed, we've been able to get this money. And so that money is, saving lives. And you can take a look at our Momnibus money tracker on our website and see where those dollars are going. And what we're doing is trying to protect those resources from the White House and the cuts. So we've been pretty successful. We have a strong track record in holding it down and protecting those dollars, but that's really a key priority in this moment.
Yeah, and the Black Maternal Health Caucus is really doing lots of great work and I would say very hard job. Yeah. And from your perspective, we know that like maternal health is being prioritized to, not really prioritized, but maybe overlooked to a certain extent at present. And what change mechanism should the public advocate for or use? Yeah.
So, we know that this issue is not partisan. It's not bipartisan. It is nonpartisan in communities, right? We know that it is not a partisan statement to say that moms should be able to survive childbirth and live to see their baby's first birthday. It is not partisan to say that pregnancy should be a time of joy and eager anticipation, and you shouldn't face the news of and being, learning that you're pregnant, that you're expecting with joy, with fear or anxiety or dread, the way that so many families are, because they know the data, they know what might lie ahead because of the failures in our maternal health system for so many families around the country. And so we really take this approach that says this doesn't have to be partisan, right? So the Black Maternal Health Caucus is bipartisan. We're working to advance the Momnibus in a bipartisan way. Some of our bills are bipartisan. It's 14 bills in one package, right? So some of those bills are bipartisan. And we're working to grow our base of support. So we invite people to join us in calling their representative, whether a Democrat or a Republican, calling their senator, whether they're a Democrat or a Republican, and asking them to co-sponsor the Momnibus, right? That's how an ordinary person can join this effort and help us end this maternal health crisis and save moms' lives. There's a lot of members of Congress, a lot of senators who are in a different life stage. They're done having babies. Their kids are done having babies, okay? Because, we have a lot of very senior, mature members and senators. And so they just are not as close to this issue as me and my friends who are all having babies. You know what I'm saying? And so
Yep. Yep.
I
Definitely.
think that that's part of it. And so they need to hear from their constituents. They need to hear from people in their states around how important this issue is and how essential the momnibus is to solving the problem.
Yep. And okay, in addition to the public, my next question is kind of like, okay, we are like, and many of the audience in on the summit, come summit day, they are researchers or
Hmm.
community collaborator working on projects aiming at addressing maternal health challenges. And for those hoping to use the research to kind of like communicate with or persuade legislator, what advice or tips would you offer like to them on like effectively communicating with legislator?
Tell your
And all
stories.
okay. So and the legislator would like to hear the patient story,
It doesn't have to
right?
be a patient. It could be that researcher. It could be that
Mm,
clinician. It could be that community leader or activist, right? You don't have to have experienced, a tragedy in your life to be able to talk about this issue. This is
mm,
something that touches all of us in every zip code. And so, we invite everyone who has a mom, loves a mom, you know what I'm saying, to
yeah.
engage as an advocate. And that doesn't have to happen in Washington, D.C. There's like right now, we're wrapping up something called a district work week. So members of Congress are all at home. This is a great
Mm,
opportunity to request that meeting to go into the office in a convenient way and talk to that legislator while they're in your community. So I know a lot of folks can't afford that expensive flight. I mean, flights are expensive. This gas prices are expensive, and so people can't just hop on a plane just to have a meeting about a policy
yep.
issue. I understand that. But making sure to tell your story in that meeting. Don't spend all the time taking a picture.
Mm,
The picture doesn't matter. Your
yeah.
story and having that dialogue about the bill is what will advance our ability to pass the omnibus.
Wonderful. So can you share examples of individual who have successfully made their case to you and what distinguished them and made their approach stands out? Yeah.
Sure. So, in my experience, we've had a lot of folks come in, particularly after experiencing a loss, right? So,
Mm,
there's been something that's awful that's happened. And often it's like the grandparents and maybe the dad that come in and are talking about what happened, the failures within the health system, the way that they weren't seen or heard. And they're asking, how to best take action to help other families. And I think it's, so generous of them in this time
mm,
of grief to come and, want to help others while they're, loving on a brand new baby and delirious because that baby doesn't have the good sleeping patterns yet. They're still caring about helping others. And so
mm.
that's why I'm saying if they can do that, we can do our part too.
That's very, I mean, touching, like remind me like some of my, yeah, not necessarily my story, but like my sisters, my close friends like stories. Yeah. And regarding the topic of framing or kind of like communicating with legislator, many researchers would like to know or guidance from you like on how to promote evidence-based like insights in the current climate of like anti-science sentiment. Yeah.
Yes. So I find that a lot of when I talk to researchers, they want to come in with their full publication. They want to
Mm,
leave a copy of their book. They want to bring the white paper that's 50 pages. Like we need not just a summary, we need the abstract. Okay,
yeah.
friends, give me a paragraph of your greatest hits. 3 pages, too long. 1 page, front and back, too long. You want us to take action? Give us that, like maybe 3 or 5 bullet points and a personal story. And that's how
Mm,
the research can get hotlined into legislative action. All of that other stuff is great for the think tank. You see what I'm saying? It's great for the
yeah.
policy analyst. It is not good for the legislator.
Okay. Very, very, very good tips and like,
Yes.
yeah, important like directions or advice like to the research group and yeah, community whoever like the collaborator want to engage with the community and then want to elevate these issues.
Exactly.
Yeah. And okay, so in terms of like advice, like trying to advocate for evidence-based innovations in maternal health while kind of like countering movement on fostering mistrust or distrust in science. Are there any kind of like good ways to balance both, or in certain times, like maybe we focus on countering movement that foster distrust in science? What would be your take? Yeah.
So I think it's really important for us to remember that distrust in science does predate this administration. So I think that we do need to grow and diversify our maternal health workforce. We need to grow and diversify across all STEM fields, to be honest with you. And it's important then that we lift up those diverse voices as trusted messengers to the communities across the country who need to hear from you. So I think it's just essential that we prioritize meeting people where they're at. And so that means, being more comfortable on social media platforms and doing those direct to camera videos. It means, showing up in the community at those big community events and talking to people, not just to enroll in the study. Like that's what I see happening. If we're really going to be honest, is that the only community engagement happens when it's time for enrollment and you're trying to convince them to join your clinical trial. But we're not in the community necessarily talking about our findings. We're not in the community talking about resources. You know what I mean? Like sharing best practices or, you know what I mean? That sort of happens down the chain in public health. It's not that researcher. And so, I just think that there's an opportunity to do that work, particularly if you're connected with like big institutions like a UPenn.
Mm-hmm.
You know what I mean? Like the university does a lot of outreach, but is that PI in the community doing that outreach on behalf of the university? I don't know. I don't know. But I think that there's an opportunity there. And then that can be a bilateral learning, right? So the community gets something, and then that researcher gets an insight from engaging with that community member, right? Like they're understanding more about the lived experience. They're having a casual conversation that can spark inspiration. That's what happens to me. I get so much inspiration from town halls and informal just huddles in the grocery store or in the library, or someone pulls me aside and is like, listen, you know what I mean? Like there's tremendous insight to be gained from ordinary people.
Okay. So it seems to me you are kind of like suggesting it is more important to have like an interactive dialogue rather than like a one-way information, like sending out, posting on social media, but then like maybe a social media kind of like post plus a upcoming 15 like minutes Zoom session to meet your researcher in the community that work on maternal health and share your thoughts with them. Is it something more like
I'm
this?
saying
Yeah.
like, in our office, we try to be digital first. What does that mean? When a big announcement, like we're thinking about how can I go live to tell people at home about this? Which creators can I partner with that have a lot of credibility in the community to talk about this issue so that that mom who's really busy hears about it, right? Because that mom is not going to be following me necessarily. That mom's not necessarily watching the evening news. We got to go and find her and engage her. So what I'm suggesting to you all is to have that same approach. Let's figure out, in addition to making sure that our publications in JAMA or Health Affairs or the New England Journal, like let's make sure that we have a plan to reach the people in community. Who are the top 10 healthcare creators and voices that we can be engaging? How do we go live and make sure that we're targeting specific like geographies in the country so that the people because the thing is, as researchers, right, who's impacted. That's the basis of your research, right? That's the nature of health disparities research, particularly when there's a geographical component. The question is, how can you be creative and making sure that the people that are impacted hear the findings, right? Because they're not reading Health Affairs in the New England Journal or JAMA, period. They're never going to ever interact there. And so with some creativity and partnerships, I think that we can get there. It's not as much like, oh, just go to the community center. I think that's part of it, but it's not the end of it.
Okay, wonderful. So my follow-up question would be, and I kind of like in our consultation, some researcher also kind of like brought up the issue would be, is there any good way or like tips like from you that to identify those health content creator in their communities? Yeah.
So there's a few places to look, but oftentimes if you search by like trending topics, you'll see people who have large followings, and then their captions are pretty good about telling you what they focus on. Right? You can see the issues or the videos or the posts that they have like pinned up top as the things that they're most proud of or they're most successful, and you can get a sense from there. For podcasts, there's charts, right? Just sort of like there's music charts, like you can see who has the most downloads, who has the most subscribers. On YouTube, you can see that information, right? These platforms make a lot of things public. And so you're looking for healthcare, current events, certain topics, whatever. And that's an easy way to engage.
Okay.
There's a lot of transparency on social media.
Yep. And yeah, they have already have the subscriber, their audience, like, yeah, and that is a good way to reach the community. And then lastly, we also want to know, for those in the audience who are working on like creating systematic changes in maternal health through like rigorous scientific research or community engagement, what key messages or piece of advice would you like to share with them in this topic in this like time? Yeah.
Okay, so number one, friends, thank you for doing this work. I know it's hard, but we can do hard things, you guys. And this is a marathon, not a sprint. So keep going. Like, we cannot give up. We are scoring big wins, even in this time where, we're facing so many challenges on so many fronts. The fact that we're able to get over $100 million in Mom of Us priorities this year is huge. You know what I mean? Like, we're able to grow the number of co-sponsors on our legislation in this environment. It's huge. And so, like, we can't give up. People are counting on us to get this done. And so we can't let them down. And the good thing is there's a huge community of support out here who, we can find camaraderie. You know what I mean? We can be collaborators. We're not in this alone. And so I would just say thank you. And also, don't give up. We need you. And I'm not giving up either. So I'm not just telling you, like, we are moving forward with the urgency that this moment requires.
Yeah. And how things always take the whole village. So as part of the village, we have to continue together to keep fighting. And thank you very much, Congress Underwood, for sharing your time, insights, and leadership with us today. And we are grateful for your continued commitment to advancing maternal health engagement and for helping us better understand how research, policy, and community advocacy all intertwine and work together to drive these very hard but meaningful changes. We continue with today's Communication Summit. We encourage everyone to carry on these insights into the session ahead. And the conversations, panels, and discussions that follows will build on many of these themes raised here today, and including the importance of centering community voices, how to kind of like interact with the community and translate the voice into research and actions. And thank you again, Congresswoman Underwood, for joining us. And thank you to everyone participating in today's summit. We look forward to continuing this important work together throughout the rest of the day. Thank you. Yeah.
Thank you.